All right.
Okay. All good?
Yep.
Okay. So everything looked really good. So as far as her exam goes, she still had that consistent arrhythmia, which is why we recommended doing like a portion of the cardiology consult. Her body condition is really, really good. Her feathers look excellent. The underlying skin still looks really excellent. No new concerns there. She still has pretty good range of motion. She has good lung sounds. I didn't find any new problems on her exam.
Her blood pressure sounded good, you said?
Her blood pressure was great, so it hasn't shot up or anything like that. When we got into that scary above the 200 range, today she's at like 120. She's perfect. And then her chemistry panel, the one that looks at her uric acid for her kidney function, perfect. So really good kidney function, really good liver function, no electrolyte abnormalities. Everything looks really good with her blood work. With regards to her cardiology consult, she has a normal sinus arrhythmia. So
what's that mean?
When the heart kind of creates the beats that we hear, sometimes her heart will go a little bit early and a little bit later, and that'll cause the heart rate to be like da 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 like that, and that's what we hear when we listen with a stethoscope. Today we did an ECG to actually measure
What's an ECG?
An electrocardiogram.
Okay.
That'll measure kind of the waves of the heart, the electrical conductivity of the heart. So where the heart is creating the beats and why it's creating the beats. The reason we do this is to look for any sort of disease-causing abnormalities. So something that could require medication or something that could indicate that there are structural changes to the heart. Hers is, like I said, normal. So she has no structural changes to her heart. She has no changes in her heart contractility or how hard it beats or how fast it beats. She has no changes in kind of regurgitation, so there's no blood flow that's going not where it should. Her heart seems to be functioning very appropriately, and this is a normal variant. So she just sometimes gets a little bit excited and her heart beats a little bit faster, and then she's like, whoa, 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 cool it down, and then she kind of has a normal heart rate. So nothing that needs medications, nothing that needs kind of follow-up cardiology care, just a normal variation for her. Yeah.
Well, that's good. And what's the test we're still waiting on?
Just her complete blood count. That's one that looks at her systemic in white blood cells and red blood cells, looking for any sort of infection or inflammation or any sort of changes in the kind of shape or size of those cells. Historically, she's always been normal, but we include it as kind of our baseline because since birds are prey species, we just want to make sure we're not missing any signs of infection that's happening under the surface.
So do you think all the changes we've done and the medications have made a difference for her?
I do. Yeah, this is one of the success cases. So I'm very happy with everything, this journey that you guys have been on. Where we are is I have a very healthy bird who's doing really, really well on the meloxicam. So as far as her recheck plan goes, I would feel, kind of with your consent, because you're her primary caretaker, very comfortable doing a recheck exam in 1 year.
Okay.
At that visit, I would recommend, again, the CBC and the chemistry and a sedated blood pressure and an exam. But as long as she's doing well, we don't have to do these 3-month blood pressure checks.
Nice.
We don't have to, drive
less
down
stress
here.
for her.
Yes, and I filled enough medication to last you about 6 months so that ideally we can keep you going. Unfortunately, with our expiration dates on the haloperidol, which is compounded, it's frustrating. I don't know if we've ever chatted about getting her medications through a compounding pharmacy, which can be cheaper than our pharmacy. And then
is that little one? The one that she takes for the plucking?
The haloperidol, I think you've always gotten filled through us.
Yeah.
We work with Wedgwood Pharmacy, which is an international, not a national pharmacy that could ship to your house, and it could be cheaper to get the medications through there. So what I would recommend in about kind of 3 to 4 months, reaching out to us and saying, hey guys, I need a refill of my medications. Lewis is doing really, really well. I just want to...
Or I can, if my uncle's going to come up, maybe I can have him just pick it up.
Perfect. Yeah. Whatever works, but we can ideally reduce those shipping fees and take that off.
Yeah. So if I needed someone to pick it up, if I couldn't come down, I could have someone pick it up for me?
Yes, all we ask is that ideally you would give us about a week in advance to put that refill in.
Right.
We really only need 24 hours, but if I'm not always checking my tasks, it might slip through the cracks, and so that's why I like to have
But
a
you
week
have
to
some
check
here
in.
today, right?
Yes.
Okay.
Yes.
And you have enough for me?
Yes.
You're going to give me enough for 6 months?
It's already done. We have enough for 6 months.
Can you give me extra syringes? 'Cause she always bites them.
Absolutely. Yes. I'll ask. Do you need them marked? Where
Yes.
They? Okay.
And can you mark them on those ones on the spot where I'm giving her
Yes.
the medicine now?
Yeah.
Okay. And is that on her prescription now?
Yes.
Okay.
So what I did for her haloperidol medication, the one you were giving a little bit extra, I've given you a range for that one to kind of give as a safe dose. So you can do the 0.02 mils, which was that really low end, up to 0.08 mils, which is even higher than what you're giving right now. But if you do feel that you want to go even higher, just give us a call and we can kind of discuss how we want to move forward with that.
Right now I think she's good at that 0.5 or whatever.
Keep her on it, yeah.
You know. And the reason I started raising it, because sometimes she shakes her head and it would go out. So I was more concerned that she was losing medication.
Yeah.
You know. And
I hear you. I do the same. My bird gets meloxicam at home, and I'm always like, "Did you get it?" And then like a drop goes, and I'm like, "Well, was that 1/10 of your medication? Was that, how much did we just lose here?" So I understand.
Yeah, she loses some all the time because she shakes her head after she takes it, or after she gets up, because some of it goes down under her beak, and then she'll get up, and then she'll go like this, and I'm like, "Did you even get any of it?"
Yeah.
So that's why I started raising
it
a little bit.
Okay, that sounds good. Yeah.
Yeah.
Right now, she's recovering from sedation very smoothly. I just want to make sure that she is not fully recovered. She'll still be like a little bit sleepy tonight, but that she's doing really well before I send her home. So
good.
Probably about like 20-25 more minutes.
That's okay.
Okay.
Thank you. I'm so excited. This has been a long road.
Yeah.
You guys got to feel good about it too.
We feel great. Yeah, we feel really, really good. But I'm really glad that she's doing so well.
Nice. Thank you so much.
Absolutely.